Good afternoon, everyone. We'll give people just one more minute to hop on, but I would love to see in the chat box your name, organization, and where you are joining us from in the state. I see April. Hi, April. Thanks for joining us. So another Ambassador Kara. So if you all just want to put your organization and where you're joining us from in the state, and we'll get going in just a second. I always look to see if we're kind of covering all corners and middle of the state. It looks like we have some good representation on our call today. I'm going to go ahead and get going with our training. Thank you all for joining us this afternoon. I am Jill Walsh, the Assistant Director at Prevent Child Abuse Georgia. We are one of the leads in mandated reporting training throughout our state. So you might have previously taken a mandated reporter training with us, or you might even be a mandated reporter training with us. And so that training is really about what and how to report. Whereas this training is going to be about why and how to support families to prevent the need for DFACS intervention or to prevent the need for a DFACS report. Our systems and practices have really historically and even currently been based on identifying deficits in families and placing blame on caregivers. And PCA Georgia, as the state lead in creating and delivering mandated reporter training that's usually in person or virtual, and also training others to do so, we really had to take some steps back and to examine how we might be contributing to issues that were really deficit based on families and not supporting them in the way that we think is appropriate. We know that reinforcing that culture of family surveillance has real and traumatizing consequences for families. And our whole mission at Prevent Child Abuse Georgia is to prevent trauma. So it doesn't sit well with us that we might have been contributing to it. So we've been doing a lot of digging the past couple years and looking what other states are doing and what the research shows us is best for families. And so we are starting to shift our thinking and our practices and our trainings and what we're putting out there. So instead of going up to families and asking, what did you do? We want our first and everyone's first response to be asking families, what do you need? And our practices and systems, we want that to reflect it as well. We need a family support system that works, connects families with resources and strengthen them. And this movement is something that's starting to emerge across the country. Just a little bit of background before we dig in. So in 1974, CAPTA, the Child Abuse Prevention and Treatment Act, that was the first federal piece of legislation that required all states have mandated reporting laws. But it didn't include specific guidelines such as training or opportunities for reporters to explore alternative family support options. And this has reported in higher reporting rates, the majority of which are unsubstantiated. And even at the time that CAPTA was passed, a lot of child advocates were worried that the overemphasis on reporting would distract from societal problems that make children less safe. So usually problems related to poverty, lack of childcare, lack of healthcare access, and even affordable housing. So since then, there have been even more laws put into place that have encouraged mandated reporters, such as penalties for people who aren't reporting. And then also many states have now enacted 24/7 reporting hotlines, which are greatly shown to increase reporting, but not always to increase confirmed cases of abuse or neglect. And even in states with mandated reporter training requirements, research has shown that it did not better predict accuracy when it came to reporting child neglect cases specifically. We're going to fast forward a little bit to 2018. So the Families First Prevention Services Act was a really big piece of federal legislation in recent years that is trying to establish more funds to address the primary needs or the upstream needs of families to prevent them from entering into foster care. So the idea being that instead of providing funds for foster parents to raise children, that we invest in families themselves so that they can stay together and have the resources that they need. However, this act does not really explicitly include some upstream prevention strategies that have been shown effective, such as economic and concrete supports. And it still focuses a little bit more on treating parents and children. So that approach ignores a lot of environment policies and barriers that families live in and are subjected to, which greatly contribute to neglect. So it's a great step forward, but we need to keep going from that act. So mandated reporting as it stands is not an evidence-based policy to prevent child abuse and neglect. Although it is often used as the primary tool against child abuse and neglect, the role of the Division of Family and Child Services, or DFACS, is to intervene when child abuse and neglect is suspected, not to prevent it in the first place. There is very little evidence that mandated reporting benefits children and families who are really more so in need of support. We even see a lot of articles showing that mandated reporters having negative experiences, feeling a lot of conflicted about these families, and making these reports. Up on the screen, I have two quotes from some prominent leaders in different states. So that first one from Safe and Sound in California. They're also transitioning to help people understand their role as mandated supporters. So their program director, Dr. Malcolm Gaines, says that we want educators, clinicians, and case managers to have more room to offer support and collaborate with families to build strengths, rather than sending them into a fear-based system of surveillance that might not greatly change the safety for a child. So when that risk of imminent danger to a child is low, we must be able to engage in offering sincere support with integrity and without the shadow of fear that accompanies it. And so that is similar to what PCA Georgia believes as well. We want to have more room to offer support and collaborate with families to build strengths. That next quote on there is from Jerry Milner, and he is a former associate commissioner at the Children's Bureau, so the federal agency. And he says that policymakers and advocacy groups are singularly focusing on increasing surveillance in the name of safety and aren't seeing the collateral damage it causes to real people that they care about, their children and the children themselves. Damage includes unnecessary separation, trauma, the inclusion of names on registry lists that will forever limit employment opportunities and economic mobility, and countless other indignities that threaten the well-being of children and parents. And so he is someone that we hold in high esteem, and he is even calling for a change in our system and how we are relying on surveillance and shifting that over to support. And so with all of this understanding and seeing shifts in our nation and looking at the research on what is best and most supportive for families, PCA Georgia is launching this new training called Lean on Me, Creating a Culture of Family Support. And this is really designed to be either a supplement to the mandated reporter training we offer or as a standalone piece, because we think all family serving professionals could learn and benefit from this as well. So it doesn't have to be together, but we think this is a message that all mandated reporters should also hear to equip them to be supporters as well. So in this new training, it covers our shared responsibility for child well-being. We enforce this concept of parental and caregiver overwhelm. We always want to be checking our assumptions about families, kind of clarifying and defining what we mean by family support. And then we want to be able to find resources to support families and engage them who may need support. And the role of a mandated reporter, again, is really reactionary. And the goal of our training today is to empower organizations and people working with families to be proactive in their response against child abuse and neglect. We want to help you better understand ways to connect families to resources and support in order to reduce that family overwhelm and prevent child maltreatment. We do not want to discourage the reporting of suspected child abuse and neglect. However, the societal problem of child abuse and neglect can't be solved by reporting alone. Reporting doesn't prevent it in the first place. But we want to get ahead of that by supporting families, and we know that child maltreatment is largely preventable. So I'm going to put everyone in some breakout rooms. And before I do that, I'm going to put the questions in the chat box. Thank you, Kimberly. I have my colleague, Kimberly Stewart-Lucas, on with PCA Georgia, who's helping me out and presenting later today. So thank you. So I'm going to be putting you all in a couple breakout rooms. Please, if you are in a space where you can unmute or come off camera, please do so. We're going to be asking, what are some things you have found difficult or stressful about parenting or caregiving? So whether you are a parent or caregiver yourself, or for families that you're working with, and then what are some resources or supports you turn to? So I'm going to give you about 5 to 8 minutes to do that. We'll see you back here soon.
I'll join room 2.
Okay, welcome back, everyone. Is there anyone or any groups who would like to share what they were talking about for difficulties in caregiving or parenting? And feel free to put in the chat box as well or come off mute.
So,
Hi. Oh, go ahead. Go ahead.
we talked about a lot about affordable, safe, and reliable childcare, raising a child with behavioral health needs, and maintaining a household, having the ability to pay bills. We talked about being able to afford extracurricular activities for your kids, affordable housing, parents being judged, if they had children with behavioral health needs, or just being judged, period, about their parenting.
Yeah, so a lot of access, affordability, juggling of schedules, and judgment, especially for those with different needs or variety of needs. Yeah, anyone else want to share?
I think we,
I'll go after you, sorry.
oh, that's okay. I think it was a consensus in our group. The problem, particularly in the rural areas, is the problem with transportation. A lot of parents don't have transportation, or transportation is not as good. There may be transportation, but it's not as frequent as they may need it. Parents may get off from work late, and the bus systems have stopped, and so that is one of the problems that we discussed. And we also discussed some of the ones that the previous person who came on talked about, but transportation should be added definitely to that list.
Thank you, Angelique. Yeah, especially in the rural areas and even non the rural areas. That's a lot to juggle and manage with a schedule and children.
We discussed transportation and affordable housing, that the families can live in, and that's comfortable too, affordable housing. And also we discussed the need for respite for families.
Absolutely. And that's certainly something that access to affordable childcare, both formal and informal, offers. Let's get one more person who wants to share.
So all of those things that everyone else has said, and then also just not having a supportive network. So like maybe you don't have family members to lean on, or you don't have, maybe it's a one-parent household, or you don't have neighbors that you trust or what have you. So all of this, not having a supportive network to help you through the journey of every day.
Yeah, that supportive network is so important when we think of just the stress and chaos that goes on in just the everyday life. And families aren't as proximity close as they used to be. We hear a lot that people used to be able to walk to their aunt and uncle's house, or their cousins were in that same neighborhood. And we don't see that as much anymore. So that kind of built in our natural support network is a little bit more spread out than it used to be, or is not as close to lend the hand in there. I would love to hear from you all in the chat box. What are some resources or support that you turn to or that you give out to families you work with? So what are some resources and supports that you turn to or that you give out to families you work with? If you want to put that in the chat box. I'm also seeing in the chat box, juggling schedules, finding reliable and affordable childcare for second and third shifts, just those day-to-day responsibilities and activities. Process for applying for benefits like food stamps. Parents might feel guilt from their situation. Single parents with little support, difficult with a flexible schedule. Finding free resources for homeless children and children with behavioral health issues. So I'm seeing for that second question, what resources and supports do you turn to? Find Help Georgia, hospice, the local state agency, foster care, parenting classes, church, husband, local mom groups. Yeah, we want to rely on those informal supports. I call my mom all the time, just to have someone there to lean on even. A food pantry, trying to find employment. DECAL's website for finding childcare and reviewing their licensing reports. Steering families towards quality rated childcare programs. Yeah, and DECAL has an amazing resource where they list out so many in the state and that you can even call and speak with someone. But sometimes that doesn't remove the barrier of cost. And we know there's many more families who are income eligible than there are subsidies to go out. Great. So I see a long list, and you guys are keep putting them in there, of all the resources that you are pointing them to, that you have at the ready. And whether you in your role as a professional or even in the different hats that you wear, even if it's not your job to access a resource navigator, if you're working with families, you're likely acting as a resource navigator in some capacity or another. So we'll talk a little bit more about Find Help Georgia, which makes it easy for people to give out resources later on in our presentation. So now I'm going to go over this concept of caregiver overwhelm. So caregivers who are facing continuous challenges and stressors can become overwhelmed and overloaded. We just talked about a lot of everyday stress that goes on, but we know that a lot of caregivers who have increased factors that are dealing with housing struggles, childcare struggles, maybe some behavioral health issues, that chaos is a lot more constant, frequent, and prolonged. And a lot of those issues can increase the risks associated with child abuse and neglect, such as the ability to properly care for a child, substance use, the disorders of addiction, mental health issues, and domestic violence. A primary reason that families come to the attention of DFACS is a lack of concrete support and caregiver overwhelm or overload. About 70% of calls made to DFACS are for neglect. Poverty creates barriers for families to have their basic needs met, such as that safe and stable living environments, food, childcare, and healthcare. And although poverty and overwhelm are often linked, many families not experiencing poverty are still overwhelmed because, as we just discussed, no caregiver is really immune to the difficulties of raising a child. I have lots of supports in childcare. And this morning, as my child would not take their book bag off to get into the car and was screaming and kind of flailing at me, yeah, I think no one is immune to that stresses that comes with raising a child. A big difference is whether you have support and resources and how to manage becoming overwhelmed and reduce that. And to show the kind of universalness, a survey put out to parents at the onset of COVID-19 It found that about 20% of parents reported yelling more or screaming more at their child, and 15% that they increased their use of discipline, including harsh physical discipline during the early days of COVID because of the stress of COVID. And some of that was job insecurity, just not knowing what's going on in the world, the fear that was occurring. But by addressing some of the causes of overwhelm and connecting caregivers to families to supports, we want to strengthen families and prevent the need for DFACS intervention because we believe so much of it can be prevented by community support. Before we go further, I'm going to dig a little deeper on the connection between poverty and child welfare involvement. And I'm going to start by looking at DFACS's intake criteria around neglect so that we can all kind of understand the policies there. So essentially, neglect is a caregiver's inability or refusal to provide a child with basic necessities such as food, clothing, inadequate housing. And from that criteria, you can easily see the overlap of poverty and involvement in child welfare based on inability to access necessities, right? So not only does it say refusing to provide, but it also has that inability. And that is really definitely tied to poverty and lacking those concrete resources. I do want to point out that DFACS in criteria has some exceptions when it comes to neglect and poverty. So at the bottom of the screen there, this is taken from the DFACS criteria code, and we are going to link to that at the end of our presentation. It says in a situation where the caregiver seeks food or clothing for the child, but does not have the resources to purchase them, a referral to community resources may be considered versus accepting a child abuse report. So this is exactly where we're seeing DFACS's policy aligning with this, but the practice of this can look a little different. So that's where we need community support to come in and people to recognize a little bit more of where we can be that supportive role versus when we need to make that report. So despite the exceptions for poverty that is in DFACS intake criteria, many families are still reported to DFACS and are even investigated. So much of our framing around mandated reporting is based on avoiding liability, kind of essentially when in doubt report or trust that gut instinct, which is kind of riddled with bias even. And DFACS's hotline can't be the only or primary tool that is given to professionals to address the concerns of family well-being. We need to start way before them. So most families who live in poverty don't neglect their children. However, families who are experiencing poverty are really overrepresented in caregivers reported to DFACS. And a national study found that children from families of low socioeconomic status were 7 times more likely to have a confirmed case of neglect than a child with a household for more resources. And this is partially due to the increased surveillance of people living in poverty. So for example, families seeking or receiving help from social safety net services, such as food and housing assistance, are more likely to come in contact with mandated reporters just by seeking help. So this can make families feel unsafe reaching out for needed assistance when really that's what we need to prevent the report in the first place. Some communities are reported to DFACS at higher rates due to poverty and inequitable access to supports. So for example, Black families are more likely than white families to be reported to DFACS. And this difference can be explained by historical under-resourcing of Black communities, higher rates of poverty that stem from policies that prevent wealth accumulation, such as redlining, and the mandated reporter bias. It's important to examine our biases when making a report and further our collective efforts to really equip families with resources as a first line of defense. I'm going to ask Kimberly if she can read the quote that we have at the bottom of the screen.
Sure. So there is a fine line between parental neglect of children and societal neglect of families.
Thank you, Kimberly. And if someone would like to share in the chat box or unmute, what does that quote mean to you?
That a system or a organization that was put into place to help communities and families has kind of, I guess, gotten backwards a little bit, and you're 7 times more likely to be involved with child welfare. Like it says above that. I forgot what I was saying. Sorry, I'm multitasking here. I do apologize.
No, thanks, April. I think you're spot on that we're kind of getting it backwards. We put all these systems in place to protect children and families, but it's not doing the best it can at supporting families, right?
Right. Right. That's exactly what I was trying to say. It's created a system that should have been built on trust and to help the families in their times of need to prevent the violence or anything. And instead, it's created, the huge mistrust that we have now. And it's just putting families in more dangerous situations and further away. So
Yeah, thank you, April. I'm also seeing in the chat box, neglect is a systemic issue, not an individual one. Everyone has a part to play to contribute to healthy families. Absolutely. It's easy to mistake systemic problems as an individual problem. I think that's a really good one. Often people think of child abuse and neglect as really the parent's fault, without seeing the bigger picture of the barriers and lack of opportunities that many families are subjected to. Society tends to overlook the situation or judge.
Jael, Miss Walsh, I just wanted to say it's harder for me to type than write it out. Also, we have expectations of parents that we expect them to know what we know in a way that we know they don't know, and then we hold it against them when we inundate them with all this information and they just need to take it one step at a time, and we got to meet them more where they're at, not where we think they should be. And it's we got to go, like, generational cycles as well. When they were kids and how they were raised, they just don't know. And even though we may have been raised differently and we have good intentions, I work as a certified peer specialist for parents, and I do wraparound services. So going in the homes, I mean, I have to go in there, take that veil off that they know what I know. And so because I learn a lot. And so therefore there's a fine line because, like, we think that they're being neglectful and they're horrible parents or whatever, but in actuality they're just doing what they know to do at that moment and they don't know any better. And then that's where the defensiveness comes in because they feel like they're doing the best they can, but instead of being taught what they can do, and they're automatically, their kids are taken away or they're having defects down their throats in a certain way. And it's just, it gets, that's where the combativeness comes from between the school systems. I'm sorry, I'm just unloading here just because this is really passionate.
Well, I
And I
think the
work with
work of
8
a peer
different
support
families.
Yeah, the
So,
work of a peer support specialist is so important, and you're at the front lines with the families in partnership. I think what you said, not holding families to our standards and our context is really important, and to better understand where they're coming from so that you can be the best support possible rather than coming from judgment and do this, that. And we're going to talk into that. So that's a great segue for the kind of next part of where we're going with that. Thank you so much, Michelle, and everyone who put in the chat box. I want to show you that while the child welfare system is designed to protect children and at a high risk level, it does, but we know that defects involvement, and especially cases that result in foster care, can have harmful effects on children and their families. Separating children from their families is a traumatic event for everyone involved and can lead to toxic stress for children, attachment problems, and feelings of loss and grief. And we don't want to do that. As people who want to prevent trauma, we want to avoid this whenever possible and preserve the family unit whenever possible. So recognizing that this trauma, the federal government requires states to enact reasonable efforts through services and supports to preserve and reunify the family prior to placement in a child foster care system. However, we see up here on the screen that removals could be prevented for a lot of the children in foster care situations through more community support and more direct assistance to caregivers. There's some of those gaps that we've seen in housing and childcare and otherwise. So up on the chart, that is reasons for a child's removal from the home in Georgia into foster care for 2023. We see neglect as being 38% of those children's removal rates. reasons. And then right next to that 19%, inadequate housing. And that to me is certainly directly connected into poverty and lacking of resources, and something that doesn't need to be going into the foster care system, that we can trigger and create processes that are outside the DFAC system to best address these families to keep them together, especially when it comes to concrete supports and other economic needs. We're going to do these questions as a group. And we usually have polling issues when we have multiple hosts on here, so we're not going to do the polling. If you feel comfortable putting in the chat box or just doing a reaction, kind of thumbs up, thumbs down in the chat box or otherwise, have you ever felt conflicted about whether you are witnessing neglect or poverty? I'm seeing yeses and thumbs up. I know early on in my career, I was not conflicted, but just really ignorant to it. When I heard the policies and what I should be doing, I didn't understand what that looked like in the context of different people's experiences in different situations. And I wasn't trained or knowledgeable enough to appropriately address families to be more in that supportive role. And now I want to hear in the chat box, how have you handled some of those situations and decided what to do? Or if you want to come off mute, as an organization or an individual, how do you handle those situations and decide what to do?
I would say to ask questions. I mean, it doesn't hurt to ask the family or the young person, whomever you're supporting, questions. And then typically, once they've told you whatever they told you, to then offer support. And my thing is like, if they don't accept the support or they don't accept whatever you're trying to offer them, is then when it's almost like out of your hands for you to then, I would say, relate to DFACs, for DFACs to then be able to be the reason of hope or to support that family. But that's typically has been the way I've done it.
Thank you, Dion. So you try to learn a little bit more, understand the context, or maybe some points that you could provide resources or help them. But if they're unwilling or unable, and we know some of these resources, it's so difficult to access that sometimes the only way to get families to support is through DFACs. Our funding is so low and limited to family programs sometimes that we reserve a lot of programs for only with the DFACs referral. And I think that is a big point that could be changed in our systems, that we need to provide additional funding for families before they reach DFACs to prevent them from coming into that care, rather than just for those highest risk or families who've had that snowball effect and much crisis that has led them there. We could prevent that from becoming a higher crisis situation. I'm seeing in the chat box talking to the supervisor and continue to help the family. Yeah, whether we make the report or not, but to continue to help the family. Talking with other coworkers, discussing what could be the causes of stress or trauma to families, to see if something that can be fixed or helped. So a lot of what you're saying is the same. So listening to families, talking to families, trying to create solutions to them and brainstorming. All of those are great answers. Thank you all. And we know that many mandated reporters feel conflicted about reporting, especially when it comes to neglect and helping families access those resources that they so desperately need. And as some of you just shared that, it can be difficult. A lot of studies show that it can be emotionally challenging for making that report to DFACs because you're not sure that what the impact will be on the family that you're reporting or what will happen after that report is made. But by connecting families to concrete supports and ways, that's something you can actively do to help, even if it's the need for DFACs report is still there, or to prevent it whenever possible. And we know that providing that support to caregivers and being that person really reduces parental overwhelm and overload. And mandated reporters like you or family serving professionals like you are often in a position of trust and have relationships with children and families, and it makes you better suited to connect families to needed supports. We believe that mandated reporters, you should also consider yourself a mandated reporter first. And viewing yourself that way first helps kind of shift this culture away from family surveillance towards a culture of family support. I am going to play a quick clip from the podcast Overloaded. Kimberly, if you want to put that podcast link in the chat box for everyone, I encourage you not only to listen to the rest of this episode, but many of them really exploring the need for media supporters and just overall support for families in a bigger systemic way. So I am going to play this now.
I would like to lead with a little bit of my own story for that question. When you think about, how do we keep families together? I recall my own experience, and I share this because I've always been transparent about my life, about my journey. I remember when I was removed from my mom's home, and I'd never forget, my social worker was a little short lady, came in, and I always would say, "Can you help my mom? How are you helping my mom?" And so I think a lot of children have asked that question. How are you helping my mom? Because my mom needs some help. She needs these things. She didn't do this because it was by choice or it was because she doesn't love me. I think if we ask what families need first, it will help us elevate putting families first. It really speaks to that. Putting families first is asking, what do families need? And really addressing those issues within our spheres of influence, within the power that we have, within the decision makings that's taking place at every level of child welfare. Because everyone in child welfare has some level of power. If we walk in the door asking what families need versus what families did, it will change a lot of our approach to how we work with families. If we advocate for dollars to be shifted and look at other states that have done certain things around providing subsidies around dollars for families for basic needs, and we advocate towards that, how will that change families staying together?
I always think this is so poignant when she says, if we walk in the door asking what families need versus what families did, it would change like the whole approach. So coming from that strength-based, what do you need versus what did you do, which is that surveillance and deficit view and kind of an automatic assumption that something is wrong. And this also really touches on many parents involved in defects. It's not malicious. It's not intentful. We don't even consider them abusers or neglectors anymore. These are people who have come to the attention of defects. The large majority of them have done so because of systemic issues or, not knowing differently and needing support. And so we want to go in and always be asking, what do families need? And starting with that lens. I want to really emphasize that child well-being is not the responsibility of any one entity. It is a shared responsibility. Many times when something goes wrong or we see in the news and everyone is up in arms, that why is this going on? What is DFACS doing? How can they prevent it? DFACS's job is not to prevent it in the first place. DFACS has a defined process based on Georgia law for screening reports and determining if an investigation is required. About 52% of the calls made to DFACS hotline in 2021 did not meet the criteria for an investigation. And it's likely that most of those calls represent concerns about child or family well-being that need to be addressed other than by DFACS. They likely were in need of resources or not knowing who to go to ask for support. The primary role of DFACS is child protection. So to investigate when children are unsafe because of suspected abuse and neglect, and to take proactive measures when they're likely to be harmed by abuse or neglect. DFACS is not responsible for investigating risks to child well-being other than abuse and neglect. And it's our responsibility really as family serving professionals. So it's our state policy our community members, including educators, neighbors, medical professionals, legislators, service providers, and others that interact with children and families who are responsible for supporting child well-being and resourcing families. So that collective unit and community system, as well as those bigger policies. DFACs can refer families to resources after investigating them, but because of that investigative role of DFACs, a lot of families don't voluntarily take advantage of those resources. So this means that DFACs is often not the best messenger for some of these resources to connect to families. But because of your role in the community, it's likely that a lot of mandated reporters are a better messenger to connect families to supports, especially those that have ongoing relationships and lots of points of contact to follow up and build that rapport. And so a lot of the rest of this training is going to focus on some best practices in supporting families. So we're going to talk about the lens through which we view others. I think it was Michelle who was talking about what standards are we comparing families to. So I want you to think of your own experiences growing up, and maybe even your experiences now if you're a caregiver, and what shapes those perspectives. I'm going to give you a minute to read through this list. I know it's a little small, but if you can just read through most of it. And as you do, think about your experiences, exposures, supports, and opportunities that might be similar or different than families you're serving. And I also want to point out that what we have listed on the screen is mostly based on the presence or absence of supportive resources. We didn't even really get into a lot of ACEs on there. So we're learning from new research that the absence of positive childhood experiences can be even more damaging than the presence of adverse childhood experiences. So a lot of these are based on that. So I'll give you a minute to read through those and think about your experiences and the similarities or differences than those you're serving. Okay, so hopefully you had enough time to read through most of these. I also want to point out that some of the points on the screen are tied to societal structures and policies that families are subjected to, rather than what people have control over themselves usually. So I'm going to ask you a couple reflective questions. So considering the impact on your life that having or experiencing or not having some of the items listed on the screen has had. So I'm going to ask some questions. How might your experiences and exposures influence your perspectives and assumptions of others? And this is just for you to reflect on yourself. I'm going to read it again. How might your experiences and exposures influence your perspective and assumptions of others? How has it shaped you? How has it shaped how you make decisions or even how you respond to stress? So how has it shaped how you make decisions or how you respond to stress? So in working with caregivers from all different backgrounds and life experiences, we always want to seek to know the why. And so seek to know the why means not looking at others' behaviors or actions in judgment, but seeking to understand the context or thought process behind them. When we take a minute to pause, stop judgmental thoughts, give grace, and ask more about the perspectives or situation of families we're working with, We're using a family-centered and trauma-informed approach. Just as we believe in trauma-informed, we also believe in poverty-informed as well. This approach should be used across the board and is helpful in overcoming some stereotypes, which are a quick judgment by taking that minute to slow down our thought process. And the stereotypes of people experiencing poverty are really deeply embedded in our society. So withholding judgment and expanding perspective is essential to listening and understanding how you can be of best help. So remember that attitudes and beliefs really shape the tone of your voice, your body posture, your facial expressions, and your actions towards others. So this reflective activity we did is meant to explore the lens through which we view families, especially those who have gone through different life experiences than we have. So whether we have examined it or not, we all have those standards by which we want to live or we've lived in our own context. So we also have a standard of how we want each child to be parented sometimes. And it's critical to examine how we do deviations from our own standards. So just because a family parents differently doesn't mean it's wrong. So remember that different is not always deficient. So we have some questions on the screen that'll be helpful to ask yourself when you have a concern about a family and are considering how you could help or even whether to make a report to DFACS or not. So what assumptions might I be making about this family? What standards am I comparing this family to? Am I aware of the family's culture and the cultural differences in parenting in that family's culture? Are my concerns for a child and family best addressed by education and community resources? Or do I suspect child abuse and neglect is occurring? So we've talked about examining and standards and comparing and trying to be open so we can best listen and be of most help in identifying what those caregivers are saying. And now we're going to talk a little bit about what we mean by family support and supporting families so we can all be on that same page. So I wanted to ask you all to put in the chat or come off mute. What does supporting families mean or look like to you? I saw Brenda. I always know that each person ultimately knows what is best for them. Providing resources, being supportive, learning about their background is always helpful. Yeah, so letting the parent and caregiver be the expert on what they need is what is best for them. Parent support meaning wraparound services, providing them with support, giving them tools they need to help themselves, listening, providing support. Yeah, and feel free to keep putting those into the chat box. So I'm seeing lots of really listening, hearing, working on what they're identifying, removing judgment from an assessment. I saw some unconditional positivity. Yeah. Being willing to learn how others parent, someone they can lean on, and support comes in all forms depending on culture. Yeah, that's a great one.
I think it's really important to also meet the families where they're at, as opposed to coming in and expecting them to be somewhere else or at a quote unquote better level or a worse level, but really meeting them where they're at and understanding what they need in that moment.
Yeah, exactly. So meeting them where they are at, especially families who are going through the chaos that can be poverty and the struggle. We can't expect this if they need to just meet their basic survival today, or we have to work towards things and meeting them where they're at. Thank you, Lauren. We have a list we're going to go through now of how we kind of define family support. And if you think there's something missing from this list as we go through it, a lot of you guys have already written this in the chat box, but if there's something we're missing, put it in the chat box for us. So seeing the best in caregivers, we've talked about this. It's easy to start with judgment. It's that quick response that you have, but how do we slow down and start by trying to identify strengths in parents and caregivers and seeing the best in them? That unconditional positivity. Normalizing that all families need help sometimes, right? No one's immune to that stress. whether they need economic support or not, or other types. No one's immune to needing help. The continual practice of family engagement, that it needs to be a continual practice. Some people aren't ready to hear it or participate in it, but that you're establishing yourselves as that place that they can come to when they're ready to get support or ready to engage. Offering empathy and understanding, so building a bridge of connection, so just being human, I think sometimes goes a really long way. Connecting families to needs they identify. And again, that means that we're really listening and trying to meet them where they are. And considering the effect of past trauma on a family and how it may impact behavior. We're all coming from different environments and contexts and living situations. And we know that trauma like this is often multi-generational, so that caregivers themselves might have experienced different things that are leading to these behaviors that we're seeing. So the whole Lean on Me concept is built on this acronym that Prevent Child Abuse Arizona has started. And so sometimes the best way to support an overwhelmed caregiver is through conversation, and having that existing relationship with the family makes it easier to have a conversation. So the acronym Lean on Me is listening. So listening to what they are saying or things that will give you clues to what they need. Empathy, we want to normalize that parenting can be stressful and challenging. Affirmation, share positive observations about them or their child, and that can build some trust and indicate that you are just kind of observing risks, but also the great things going on. Non-judgmental, so people rarely accept help when they're feeling judged. So withholding that judgment so that we can expand perspectives and listen is essential to how we can help. So some other tips that we always say is to serve it warm. A warm handoff involves the connector knowing about and being familiar with the resource and making that connection with the family themselves. So sometimes it means literally making that call with them there, knowing who's going to be on the other end of the phone. I know someone who going to meet them directly. And so making this line handoff or introduction is so much more warmer and makes someone feel like they belong, or they already know someone in that organization that they can talk to and go to. I want to always manage expectations. So if you know that a resource has a wait list, or that parents need certain documents to enroll, or that there's eligibility criteria to qualify, we want to share that up front. So this way they'll know what delays or hurdles to expect. Families are often sent in many directions or dead ends, or have heard no a lot. So the last thing we want to do is send them on a dead end, but we do want to manage expectations of what they can expect, so that they know that if they push through a little more, or that, okay, they said this was going to happen and it did. So it's also building that trust in what they can expect to go on. And asking parents to help spread the word about resources that has worked for them or they liked. So this engages parents and empowers them to also be that community connector. So I think, as Michelle said, she is a peer support, but we also want parents to be parent leaders themselves in those communities and networks of sharing what works and letting others know, so they can be that resource to others. And so we're going to talk about how we connect families to resources that we find. And simply giving someone a phone number to call in order to obtain a resource might not work, or giving them a printed off list or something like that. That's a very kind of cold, I don't know what to expect. I don't know who that is. I might get an answering service or something like that. But sometimes resources, even when they are available, it's difficult for families to reach out and to ask for them, or to know that they're even available or there. And so just kind of represent this, I have a little example. So if you will, imagine that you're in a public restroom stall, and after you're done using the facilities, you realize that there is no toilet paper. There are two people washing their hands and chatting at the sink. Do you ask for help? If you want to put a thumbs up or a thumbs down, or a yes or no in the chat box, or even a depends. I feel like we see a lot of people say absolutely. I'm kind of like an it depends person. And I know there's many of others who don't ask, because I've been in places where there's obviously no toilet paper. No one says anything, even when I go in or the next person. Okay, I'm seeing lots of yes in chat boxes, and I feel like you guys are also more likely to say yes in the chat box if you would ask for toilet paper. So I'm going to base my study on that. But I think we've all been in situations where we feel nervous or hesitant to ask for help, depending on what it is, right? So what would make you more likely to ask for help in this situation or another situation? What would make it more likely for you to ask for help in this situation?
Hi, I'm Cynthia coming off of mute. I was just going to share if I heard someone with a warm voice or laughter or lightheartedness, that would probably make someone more likely to say, "Hey, can I have some tissue?" They don't have any tissues here or something like that. If you can get a like a comment, something, you know, laughter is good. Hey, guess what? They don't have any tissue in here. So those type of things would make someone, I feel like, more likely to ask for help.
Thanks, Cynthia. Yeah, I exactly agree. So someone who's laughing and warm, and that makes me feel like maybe they're less judgmental that I'm going to ask for help or that I'm in this situation. They're going to take it more lighthearted and more likely to help, right? And I'm also seeing in the chat box how desperate I was. That's a good point. If I knew the other people, if I knew someone in the bathroom, I'm seeing that. So you're more likely to ask for help sometimes if you know the person or you know that you're not going to be judged from the person even. And I think that's what, when we do this training, a lot of people say. So building that trust and accepting help from someone that you know or trust or feel like you won't be judged from is really important when we're building relationships with families, and especially if we're expecting them or, you know, looking to provide some type of resources or support to them that's going to help prevent them from coming to the attention of DFACS or needed to go there. That we want to do this in a non-judgmental way and build that trust with them. And so part of that is really normalizing help-seeking behavior. It can be so hard to look out or to ask for help, but we want to normalize that as much as possible within our conversations and organizations. So in order for families to overcome that reluctance, normalizing it. We want caregivers to understand that seeking, asking for, and accessing support is normal and respected, that they're not the only ones facing that challenge or need help. It takes courage and strength to seek and accept that. So the points on the slide are some ways that we can normalize the need for help within our organization. So first off, we want to make resources conspicuous. Don't make them difficult to find. Sharing flyers, posting them in highly visible, highly frequented places, having a corner where parents know that's where it's going to be. So reception areas, community bulletin boards, libraries, pediatrician office, maybe it's in the portal, it's always shared in a newsletter. So something like that. We want to share them with everyone, not just in a time of crisis or need or you're singling someone out, but they're shared all the time with everyone. So sometimes we can't tell when someone needs help or what's going on. So we want to share them with everyone all the time. So putting them in newsletters and other communications that are received by all caregivers. We want to offer resources sometimes in a passive way so that we're not singling out a person. And that way we're reinforcing that everyone needs that help and establishing ourselves as well as a place to seek support or help for various needs. So up on this slide, I have examples of how organizations can connect families to support in ways that normalizes help-seeking behaviors. And so remember, resources aren't just concrete supports like food and housing. Resources can also be opportunities to connect to others, like family social events, parent support groups, or even volunteer opportunities. So take a minute to see what is up on the slide, and I would love to hear from you in the chat box or unmute of some ways that you normalize giving support in your organization. So I'll put that in the chat box. So what are some ways that your organization normalizes the need for support?
Our school has a parent computer lab where parents can come in anytime with the assistance of the school counselor, which is me, or our parent advocate, and they can use our computer lab. to help with signing up for benefits or whatever they need.
Yeah, so having an open commuter lab rather than maybe a caregiver having to come up and ask to use something or make that request that it's open and there for them and that they see others using it as well. I'm seeing Dion, we make one pagers for colleagues within our agency, making it accessible, creating family work-life balance, having brochures for many different organizations, and also putting them on the website. So sharing a lot of the resources you refer to the most and having them easily to give out. Inviting community resources to come to the school, and families are able to ask questions and listen to what they offer. Yeah, inviting someone to come over. So now they know someone from that organization or from that program, and they have their contact information, and they'll probably feel a lot more at ease to contact them. And they know if it's right for them or not before they go down that wormhole. At the visitation house, we keep resources or information on the dining room table, fridge, and other places. So just like in a home, you're putting those things out. I love that. We do training and provide any resource guides to youth and families, which are filled with a lot of resources, and holding resource fairs. The school has a resource room that has clothes, food, hygiene products, and it's open for the students and families. Yeah, so just making that this is part of our school system and services. This is for everyone. So in our visitation location, there are many organizations, and we'll walk the parent to them. And I love it when resources are almost housed together, and there's some great examples of that in our state. So you can just walk down the hall or walk right across the street, and all those agencies are kind of clustered together because it's more of a one-stop shop that families can go to, especially knowing that transportation can be a really big barrier. Thank you for sharing those. So this is an example of the LeBron James I Promise School that they started, and some of what they do to normalize not only help-seeking behavior, but supporting families and caregivers.
Kids arrive for the first day of school today in Ohio as a new approach to fix an old problem takes center court, led by someone who knows their stories more than they could imagine.
I know exactly what these 240 kids are going through. I know the streets they walk. I know the trials and tribulations that they go through because I've been there.
Which is why NBA superstar LeBron James and his foundation are opening this school in Akron for at-risk third and fourth graders who struggle both in school and at home.
The most important thing that we can give them is structure and a sense of they just want someone to feel like we care.
I Promise is a public, non-charter school. It offers an innovative approach, a longer class day, and a longer school year, and provides support to help kids with trauma. The school will also help parents find a job and have an on-site food pantry for families.
These kids should still have the same opportunity as everyone else. These kids are our future, and no matter if I'm playing in Los Angeles or not, Akron, Ohio is always home for me.
A kid from Akron.
So I couldn't find the other clip that I had originally seen, but the I Promise School does a lot more than it even says in there. So it provides all the students with all the school supplies so that children aren't singled out when they don't have something. It provides breakfast, lunch, and afternoon snacks for free. It also has laundry services. We know hygiene and accessing those can be a really big deal. It has adult GED classes, and it pays for college for those who are there. We know that this is not a typical public school. It also has a lot of funding from outside of that school system that it's making it happen. But I think that all funding kind of shows what is truly needed for students to succeed and represents that additional funding, the communal wealth that might not be existing in that neighborhood that's coming in, that we know some other neighborhoods come from an area of high community wealth. And so those resources are there in other ways already. I also want to give some examples of what other organizations, states, and national agencies are doing along the same kind of thought of supporting first. Prevent Child Abuse Arizona has been kind of the launcher of Lean on Me. They did focus groups throughout their state from mandated reporters, DFACS workers, families who have been involved in the system and families who are not, on how best to serve them and what is needed for them to succeed. And they have a toolkit. Kimberly, if you want to go ahead and put in our resource page. So we have a resource page with all the links that we're talking about today and resources on there. You can go back and look through. So it has the podcast, it has the PCA Arizona information on it. Doris Duke just launched the opt-in for families pilot program. So there's 4 states that are being funded through Doris Duke, and they're seeking to show that actively connecting families at their earliest sign of need to direct support for basic needs and coordinated support services is more cost efficient and more successful than families going through alternative means or kind of trickling them down into the DFACS system or otherwise. So they're really focusing on preventing the need for families to go into the DFACS system, not just the need for foster care, but for entering the DFACS system at large by providing more resources to them. I've also spoke recently with some of the regional coordinators from the Georgia Division of Children and Family Services. They have partnered with the KC Families Program for a couple different counties and their State of Hope ecosystem on a pilot that is family support services. So for families who are kind of screened out or they don't meet the need for investigation, they just need some support. They have partnered with a lot of resource agencies in their area to work with them to best address the needs of those families in that way, rather than just giving them kind of voluntary or involuntary ones. And so they've seen some early successes in just families being appreciative and wanting that and reducing recidivism back into it. And so that is the Division of Family Children Services with the KC Family Program. And I believe that's in Region 1. I'm trying to get a little bit more on that to highlight them and their work later on. I'm now going to pass it over to a really big initiative that PCA Georgia and others here in our state are doing to better connect families to support.
Thank you, Jill. And I'll place this in the chat. So although it might not be in your job description, many of you act as an informal resource navigator. So we're excited to present to you and share with you Find Help Georgia, which is available to help seekers and providers such as yourself to better connect families or individuals with needed services. Find Help Georgia provides accessible self-navigation from the website, whether it's financial assistance, food pantries, medical care, or other free or reduced cost services specific to your area. I know that you all agree that a centralized virtual community resource guide is an invaluable tool, knowing that your families and community members all need access to resources. It's a free online directory that lists free or reduced cost direct services. So on findhelpga.org, there are 3 ways help seekers can search for resources: by entering their zip code, using an online chat, or calling the helpline to speak to a Find Help Georgia resource specialist. We also want to encourage you and your staff to download the Find Help Georgia mobile app to share with your clients so they too can download and self-navigate. I want to point out some key features that will help you and the families you serve utilize the Find Help Georgia tool. Searching by zip code will bring help seekers to this page where they can easily browse by category. If you are an individual or working with an individual whose preferred language is something other than English, Find Help Georgia has an integrated translation tool that enables the entire site to be translated into more than over 100 languages. This may come in handy when you need to print, text, or email resources to a client in a language other than English. If there is a resource that you commonly give out that you don't see listed, you too can suggest the organization of the program be added. Find Help Georgia lists free or reduced cost programs that provide direct services. So if that applies to your organization, we encourage you to make your organization or to make sure that your organization is added. So in the chat, when we're talking about normalizing support, a lot of you added in the chat some of these programs that can be added to Find Help Georgia. Also, organizations can claim their program listing on Find Help Georgia to keep their listing and profile up to date, along with receiving and giving referrals. Get more information, training, and one-on-one support on using Find Help Georgia. Prevent Child Abuse Georgia offers monthly trainings to get you started, and my next one is tomorrow at 1 p.m. You can use the QR code on the screen or go, and I'll place these, oh, you already did, go to these links to learn more about Find Help Georgia.
And I'm so happy to see so many of you already kind of putting Find Help in there, but a lot of the times you don't have all of the resources or knowledge, or you're not working directly with families in a way that you know all the resources available for their needs. That's why Find Help makes it easy for anyone who spends a lot of time giving resources or doesn't really know what's out there to help families quickly search through them and find some things that work for them. Or we can give out promotional tools to you as well, so that you can let caregivers know and they can search directly. It's designed to be user-friendly enough for caregivers and families to search themselves as well. And there's also a helpline on there if they want to make a call with a resource navigator, as Kimberly had mentioned. So today we talked a lot about supporting families and connecting them to resources kind of at the individual level and what your organizations and programs can kind of do for there. I also want to spend just a minute discussing some of the bigger changes needed to create a culture of family support. I want to challenge you to think about preventing child abuse and neglect in terms of policy. So to consider the political determinants of family well-being, policies that allow or act as barriers for caregivers to create nurturing and stable living environments for their kids, as well as reduce the stress of parenting. I'm going to go through some facts and numbers on policies that are proven. I have all of these listed out on that Lean On Me resource page. Kimberly, if you want to put that back in the chat, I'm going to read through these kind of quickly just to give you an idea so you can connect the dots between policies and child maltreatment prevention. But if you want to look into these stats and resources and research a little bit more, you can go to that page. So a $1,000 increase in income from either the Earned Income Tax Credit or the Child Tax Credit is associated with a decline in child maltreatment reports by 7.7% in the 4 weeks after payment. And that Earned Income Tax Credit is given out federally, but some states also implement it at the state level. So for states who also implement it at the state level, compared to those who don't, there's an 11% decrease in foster care entries. Georgia does not have the state level Earned Income Tax Credit. For every $1 increase in minimum wage, it was associated with a 9.6% decline in neglect reports, primarily for children under 12. Georgia has the federal minimum wage of $7.25 an hour, which has not changed since 2009. So Georgia is at the bare minimum compared to many of the states. Each additional month that low-income mothers receive a child care subsidy is associated with a 16% decrease in the odds of neglect report and a 14% decrease in the odds of physical abuse report. So talk about not only the ability to have proper supervision, but also the respite and the freedom of opportunity it provides to parents to work and respite. So for states that have newly expanded Medicaid in 2014, it was associated with reductions in the average rate of child neglect reports per state. So 13% reduction in neglect reports for children 0 to 5 and a 15% reduction for neglect reports in children 6 to 12. And that's compared to states who did not expand Medicaid from 2008 to 18, which Georgia is one who did not expand it. And in fact, we know that Medicaid expansion is a key strategy for addressing housing instability for people with low incomes. So evictions fell by 20% in Medicaid expanded states compared to non-expanded states. So it's this whole cycle of having housing, but having health insurance, but having health and the ability to work, and that whole cycle of it and addressing different points throughout there. And don't worry if you didn't catch some of those statistics, as I said, we have them linked in that resource page for you. And it's just to give you an idea of things we don't typically think of, reducing child maltreatment rates, that we need to start thinking of those political determinants of family well-being. And before we wrap up, I want to leave you with some additional tools and resources. I had Kimberly put this resource page in the chat already. It has the podcast we listened to along with another one, some articles, research pieces on the statistics that we've given out today, some of the Lean On Me pieces with those tips and tools. And I also want to point out one other thing that I haven't mentioned yet today. So here is the page. We recently released a brief on mandated reporting and how people can shift to that family supportive model. And I wanted to highlight this one, the Strengthening Families Self-Assessment Tool. So if you turn to page 28 of this, or really all the way throughout, these are self-assessments for organizations or individual staff to take that kind of assesses your family supportive programs and policies and what's going on. So excuse me, this is the one for concrete support in time of need. And I really like this assessment because even if you're not assessing yourself, even if you're just reading through these bullet points, it's lots of ideas on how to improve practices to support families on there. So some of these saying staff proactively respond to signs of parents or family distress by XYZ. When a family is experiencing extreme difficulties or crisis, and they have a lot. So there's lots of different things on here. So not only the concrete support one, but they have ones on knowledge of parenting and child development, social connections, parental resilience, and the rest of the protective factors. And I think this is a great takeaway to look through an assessment. So will that assessment be sent out? The assessment is on the resource page, and I'm going to put it in the chat box right now too. So you can have that. And I want to thank everyone so much for participating in our webinar today and joining us as we embark on this mission to really redirect people to be first called as mandated supporters and to provide those concrete supports whenever possible, and to consider the best way to be that support for families rather than just act as surveillance in other ways. So we hope that you enjoy that. We appreciate all of your engagement, and please share that resource page with your organization and whoever else so that we can spread the word on this. We also, all of our mandated reporter providers are also being trained in this to deliver it throughout the state so that this training curriculum will be widely available to organizations and communities around. We do ask that you complete the evaluation, as this is kind of our launch. We want to collect a lot of feedback throughout the state so that we can keep improving it and speaking to all of your needs as well. This is also how you're going to get the certificate of attendance today. So complete that evaluation, and at the end, you'll see a link off to the certificate. We're going to hang on for just a minute if you have any questions or want to share anything with us. Otherwise, if you've grabbed the evaluation link, that is the end of our presentation. So feel free to, take those extra couple minutes for self-care. But we'll hang out just for another second for any questions.